You're watching Beyond Markets. Welcome, I'm Esther Awuni. Many thanks for joining us. On the show today, we'll begin with a discussion on digitizing maternal and public healthcare in Nigeria. Later on, the Commissioner for Health in Lagos State tells us about affordable digitized public healthcare in the country. As always, you can join the conversation with the hashtag Beyond Markets, and you can follow my Twitter handle too at Esther Ubudaga. Now, 8 African countries top the list of the 10 worst countries to be born in the world. That's according to the latest Unicef report on child and maternal mortality. Now, as Africa talks leveraging on digital to improve maternal and public health care, CNBC Africa's Christy caught up with Toyin Saraki, founder and president of the Wellbeing Foundation at the Forbes Africa and Phillips Future of Health Summit. Now, they dissect the continent's response to policy, infrastructural and cultural problems amidst the quest for affordable, quality and digitized healthcare. Take a look.
The thing that really confounds us slightly in Nigeria is that we do have the network of hospitals. We've got mothers who are quite educated, quite savvy and wanting to access care. And we've got health workers who are quite dedicated in wanting to give them that care. But we still have this problem of extremely high mortality. And working at the front line through the Wellbeing Foundation all these years, I realized that that is because we haven't really fully integrated our systems. I think that from a rights-based approach, every mother should be able to feel confident that she can walk into a health center as close to her as she lives, and she should be able to get care that is accessible, affordable, respectful, and to a high quality. Secondly, I believe that we need to be able to track the quality of that care. So I'm a big one for saying every woman should actually have a personal health record in her custody, not just in the hospital. And, adopting this, such as the one that we wrote at the Wellbeing Foundation, versions of which are used all over the world, it does actually empower the mother to be an informed health partner in her own outcomes, because it raises her standard of what to expect. From the mammocare that we do in our antenatal classes across the country, we're discovering that women are now coming in for 8 visits during the pregnancy. They come for the class and then they stay on for the antenatal care, because we only get the classes in hospitals. And none of our women has died. In over 22 months, over 200,000 women. No one single mammocare mom who has been to the classes has died in childbirth. So it does, it speaks to the integration of the system, where you're not just delivering care in isolation in a facility. You need to link that care to the health worker's attitude, to the equipment in the facility, to how easy it is for the mother to get that care, and then make them actual equal partners in getting the right outcomes.
Now, Wellbeing Foundation Africa is very well circulated far beyond Nigeria and across Africa.
Yeah.
How would you describe the maternal experience across the continent?
I would say that the maternal experience across the continent, while it does have pockets of excellence, I think Africa is dealing with the same problem. There's, especially sub-Saharan Africa, we have infrastructural issues with hospital facilities not having hygiene, not having clean water. Then we have cultural problems with the woman feeling she has to ask for permission before she accesses medical attention. And these are some of the things that the digital age can actually help us combat, because your mobile phone is only an arm's reach away, or even a hand's reach away. If you can get information out to women about, first of all, what they should expect, what a normal situation should look like in childbirth or even in childcare or looking after a neonate, and if it doesn't look like that, where to go and what that kind of care should look like, you're already empowering that woman with the education and the information that she needs to keep herself, her child and her family. Everybody talks about maternal and child health, but I'm trying to imagine a world without mothers and children. Where would our families be? So we need to begin to look at maternal and child health as family health and community health. And then when we start looking at the investments that are needed, the investments that you put in place to make a hospital good enough for a woman to deliver, a hospital good enough for a child, is the same investment that you will make to make that hospital good enough to look after a community.
So within an African situation where the current reality borders around affordability, access, how can we even begin to have conversations around leveraging on technology to improve maternal health?
We have to leverage on technology because technology is a smart investment that allows us to save money across the board. We're talking about universal health coverage. Universal health coverage is basically, aside from the affordability and the standard of the care, it is basically insured care. So even if that care is free to the beneficiary, it has been insured either by government or by the beneficiary themselves. Now, how do you cut across the economies of scale that you need to without technology? We are going to need technology to provide a data bank of every single health facility, every health provider, and every patient. It is only through that that you can begin to save. You know, if I'm running a health facility and I have only 20 patients and 5 of them fall ill, I cannot provide covered care because the margin is too high. But if, on the other hand, you've got 198 million people, which we are in Nigeria, and all of them are mandatorily insured, if 35% of the 198 million fall ill, you can afford to treat them with the funds of those that don't fall ill. And you can afford to access those funds to improve your healthcare facilities, to make them actually positive, pleasant places where people come to stay well. You know, we haven't even begun to touch on non-communicable diseases, and this is another explosion just waiting to happen. So it actually, investing in the digital end of it to keep everything else connected, it's not a discretionary investment anymore. It's actually going to be a mandatory investment and the smart, deliberate decision to have us get a better quality across the board and to also know where to deploy resources to. You know, without the digital element, how are we going to know if this hospital has more of what it needs and not transferred to the next place? And, you know, the issues of wastage. I just think it's a smart investment, and I don't even think it should be discretionary. I think it's a must. It's an imperative.
As far as you're concerned, it is imperative, it must be deliberate, it must be consistent.
It must.
When we talk about leveraging on digital, and we've also talked about it also including government insurance.
Yes.
Now, that raises the question, advocacy, which is what you do. To what extent do governments across Africa open their doors to you?
Well, I think governments open the doors because as an advocate, I'm not advocating from the point of view of my foundation. I'm advocating from the point of view that health and education are human rights. I'm at the front line, but I'm also at the tables that count. And so I see myself as a bridge to be able to make sure that, for instance, in my role as Global Goodwill Ambassador to International Confederation of Midwives, that is over 600,000 midwives in over 136 countries. So it's the power of my voice is not the power of my voice. It's the power of their voices, their realities, and also their intelligence, because they also have successes that they have found from different countries. So I don't advocate just for the sake of advocacy. We have a lot of evidence, and it's what we call evidence for action. When you go to advocate to a government and you have evidence that is tried and tested and shows results, they listen. And when they listen from the civil society perspective, we can also take some risk. So quite often I will pioneer or pilot a program because I believe in it. So my own philanthropic endeavor lies in first testing that thing and showing that it works. So if I, in my small foundation, can show you that using health records works, or using tranexamic acid can stop postpartum hemorrhage, from a government point of view, it is for you to come and take it up and go and replicate it and take it to scale.
From your interactions with governments across Africa, how would you describe their political will?
Well, it's different. I mean, some governments are very strong on human resources. Like, for instance, the Rwandan government has taken it that no woman should die in childbirth. So, for instance, there, when a woman dies in childbirth, it flashes up on a ticker tape in Parliament, so that they're not dealing with statistics like 30% and 40%, they're actually counting every
name and
individual woman, yes. And that really strengthens the accountability narrative. Different parts of Africa deal with things differently, but I think the thing to understand is that we have mechanisms that we can use to pressure governments to act. For instance, the Alma Ata Declaration towards universal health coverage was in 1978. That was 40 years ago. The WHO is 70 years old this year. The Abuja Declaration was 15 years ago. But now, because of the digital technology allowing us to even access evidence from other countries, we can make stronger arguments for better change and better development, and also for sharing of success so that people don't have to make the same mistakes.
During your presentation earlier, you touched on 2 points,
Yeah.
low-cost solutions,
Yes.
as well as the need to have a centralized database. Can you elaborate on those?
You know, there are certain low-cost solutions that work. We know, for instance, that if you clear a baby's airways within minutes of birth, you're not going to lose that child, and you're reducing the chances of birth injury. We know, for instance, that if a mother goes into hospital at the right time of labor, or she has a trained and qualified midwife with her, if, for instance, she wants a home birth, you can actually prevent complications from arising. So what I would call a low-cost solution is not necessarily a solution that's cheap. It's a solution that is cheaper because it is being applied at the right time of intervention when it is needed. But we cannot keep just looking for little bits of sticking plaster here and there. We need to repair Nigeria's public health system. And that repair is needed at a primary healthcare level. All the things we use to measure effective demographic dividend occur at primary level. Immunization, we have only 1 in 4 children being immunized currently. We have an immunization crisis, but where does immunization take place? In primary healthcare centers. Family planning is going to be a very big issue. Where is family planning supposed to be given out? You know, for this population explosion that we're all dreading. It's all at the primary level. So we need to reach that point that tells us that we cannot use tertiary and secondary level medicine properly without repairing the primary level, which is where health is cheapest, but it's also where health is needed the most.
Toyin, my final question to you. When is the future for digital in maternal mortality? When? How far?
For me, the future starts today. My midwives are already trialing something called MOM. Before, we used to have this in our written records. Now, but in the written record, it used to depend on the midwife writing it down and going back to analyze it herself. Now, the MOM application, for instance, is allowing our midwives to put in those same tick list answers, but the machine is now telling the midwife, it's sounding an alarm to her. Okay, you're dealing with a high-risk case. You may need to call in a doctor. The future is now, and it is an absolute social imperative that the future be now. There are 198 million Nigerians. I don't even know how many people there are in Africa, but Africa has the intelligence, and Africa has the know-how to lead. It's a matter of making the right strategic partnerships and making sure that we're not reinventing the wheel left and right. We're actually cross-cutting to allow the intelligence to be shared. And then we're going to see the impact. Just imagine the impact of an Africa where everybody is sharing the knowledge and actually applying it.
That was CNBC Africa's Christy in conversation with founder and president of the Wellbeing Foundation Africa on digitizing Africa's maternal and public health care. We'll take a short break and we'll be right back with the rest of the show.